I'm Dr. Turpen from DVM Animal Clinic in Newburgh, Indiana, and I'm just going to be discussing some of the benefits of having the ability to measure intraocular pressure in your veterinary practice. And the big thing is that, we see a lot of eye cases that come in, red eye with drainage, things like that. But sometimes when we have an eye come in, the question is it something that we can treat here? Is it something that needs referred to? What is the best route of treatment? And a lot of times, to know those things, it's very helpful to have an intraocular pressure. And there's a couple different devices that can be used to measure intraocular pressure. The oldest device being a Stoit's tonometer, which I have used, and if they're not put together properly or not kept clean, they malfunction very easily, and they have a very huge plate that has to touch the eye, requiring an anesthetic be put in the eye before use. And then there's a lot of different ways that can make them very difficult to get an accurate reading. Newer devices have kind of eliminated that from general practice, and the two main devices that we see are typically the TONOVET and the TONOVET. And in our practice, we do a lot of fear-free work, and we work with a lot of very scared patients, behavioral patients that you really have trouble getting too incredibly close to. And we also do a lot of work with exotic pets. And so I personally really like the use of the eye care TONOVET Plus for my exotic patients. And I'm going to explain to you why, explaining some of the differences between these two devices. So the TONOVET is an applanation tonometer where it has to touch the eyeball with this little flat plate. You put a little condom on it, and that keeps it from asterally touching the eye. And it has to be fitted correctly. So as you can see in the little picture here, if it's not fitted correctly, if it's too loose, too tight, it can affect your readings. The benefit to this device is that you can do it at any angle. It doesn't matter if you are perpendicular to the floor. It doesn't matter where the patient's head is. But you do have to still put a topical anesthetic on their eye when using this device, and if during restraint they are squeezed too tightly or in the wrong way, it can affect your readings, because this is based on the ability of the globe to dent in when that's touched. And so while it's easier to use in some respects, it's also got a lot of little things that can go wrong. The TONOVET Plus is a rebound tonometer, and it uses a little probe that goes inside right here. The older school models, the big downfall that I heard a lot of people complain about was the fact that when you put this in, if you didn't hold this upright like this or keep it pointed up in some way, that little piece would fall out. The nice part about this device is when you put this in, it grabs it and holds onto it, and you'll see that in a moment when you see a couple of videos of this device in use. But it does a little vibration, and once it's done that, you know that that is locked in place, and you can do this and it's not going to fall out. So that eliminated that challenge with this device. The other challenge with this device is that it has to be upright, and when it's not perfectly upright, perpendicular to the ground, there's a little red light here that'll turn on and tell you that it's not in the right placement. When it's green, you're good to take a measurement. So you have to be careful with your patient's placement. Well, since I work with a lot of exotics, placement's not hard. I'm just holding my patient like this. The challenge is that when I'm holding my patient, and I'm waiting for this little lizard to open its eye, I only have split seconds. And with this device, I have to physically touch it to that eye repeatedly, and oftentimes the eye is too small for this plate. As you saw, the probe on this is tiny, and so this can much more easily contact their eye, and it can do so a lot faster because the computer is the one shooting it forward and pulling it back. And so it's easier to capture those split-second open eyes with this device, and the eyes that are tiny, this device can touch them, whereas this device can't. So I have found that this one is very useful for that reason. This device also has a setting for rabbits, which I have used repeatedly for other exotics, including reptiles, birds, small mammals, and it functions fantastically for those purposes, and is very comparable to the readings that I get with like the dog setting. This device is very simple to use. It turns on with the push of a button. It can measure. It has the different settings for different species, so canine, feline, lapine, equine. So equine and feline you really don't use a lot in small animal, or equine you don't use a lot in small animal practice. Feline is more specific for cats for their shape of eye. So very easy to use, in my opinion. You know, the slightest thing is making sure you're in the right spot, but the little green light makes it very easy to see that, which was one of the #1 challenges with the older models. So I find that because with this device, it's barely touching the eye, it's a very small touch point, and it's a very quick touch point. We're not having to put a lot of pressure. You don't have to use a topical anesthetic, and the topical anesthetic of choice it is also because different topical anesthetics will affect your eye pressure. And I've been in practices where the only topical anesthetic available would affect your eye pressure reading, and so it made it so this device would not really be usable, but this device would be. Also in the behavioral patients where we can't get close enough to them to restrain their head, in this device, if an owner is restraining a head for us and they squeeze too tightly, it's going to affect our reading. Whereas with this device, if the owner's restraining and we're just trying to do a very quick in and out, it's much easier to get that quick, fast reading with an owner restraining on this device and have it still come out very accurate. So I've got a couple videos for you to show use of this device in a couple various species, a frog and a lizard, as well as use in a dog with juvenile cataracts. So we take the little cap off, take your top off here for your probe, put the probe in this little hole right here, turn it upside down so that falls in, turn it on by pressing that button. Once it's on, it'll vibrate like that. That means it's locked in, and if you want to tap, pull out, and then if you look here, you can see the green light, red light, so if it's not at the right angle, it turns red. And then you've got your settings here, so a lot of the time I'm using rabbit for the exotics. You go over to setting, click that center button, and you can change it to canine, and then go back to measuring. $20, $21. So yellow means some variation. 21. All right, so 20, 21, and 21. And then we just repeat for the other eye. I know. Hold on. Patience is key.